Welcome to our continuing series of virtual voices focusing on the United Nations Sustainable Development Goals. Our speaker today is Dr. Scott Ratzan, who is the co-founder of CONVINCE, Coalition for Vaccine Information Communication and Engagement, and leads efforts with the business partners to convince with the U.S. Council for International Business Foundation. Dr. Ratzan has 3 decades of pioneering accomplishments in health communication, health literacy, and strategic diplomacy. He is the editor-in-chief of the Journal of Health Communication, International Perspectives, and also a distinguished lecturer at the CUNY Graduate School of Public Health and Health Policy. Prior to CUNY, he was a senior fellow at Harvard Kennedy School. He has adjunct professorial appointments at Columbia University Mailman School of Public Health, Tufts University of School Medicine, and University of St. Andrews School of Medicine. He is also a board member of WIT. Over to you, Dr. Ratzan.
Well, thank you, Dr. Durbach. And let me first congratulate you, if I can say, for the many years, decades now, of establishing world information transfer and not only hosting these virtual voices, but the hundreds that you've not only brought through the United Nations, but the thousands that you've touched and the millions that you're hoping to have a better world for with the work that you do with health and the environment, and most recently, and currently, of course, the challenges that we face in Ukraine. So I'm here today to talk about there's more to be done. And I will show some slides just to really walk us through, but to have more of a discussion. And some of these are meant to be more visual and get us to think, but also there's some specific facts that are here as well. And I know many of you are, of course, watching this live and will have the opportunity for some questions, but also many of you will be watching this when it's recorded. And there are opportunities to contact both World Information Transfer, myself, and others that you'll see on the slides, as Christine mentioned. I lead efforts at business partners to convince, and also have a number of academic and other linkages that I'm hopeful we can make a difference for a better world. So I'm going to share my screen and just start again, thanking Dr. Durbach for this opportunity today, and to remind of the challenges that we're all together on the unfortunate situation with the Russian aggression in Ukraine right now. And when it first started in February, the New York Times had this visual reminding of a Soviet-era statue that was transformed with the Ukrainian flag, and it says underneath it, "Knowledge is strength." And knowledge is one of the parts that we hope will make a difference in our world, but there's much more that needs to be done. And our theme with business partners to convince, and our work with the USCIB Foundation, is there's more to be done. And hence the theme today, there's more to be done to attain the global goals. World Information Transfer, being a official NGO of the United Nations linked with ECOSOC, has an important role to play. And St. Jerome here and others know that what we do in not only governance, but also with our global institutions, are sometimes uncertain. And we know, unfortunately, more than ever right now, not only witnessed at Ukraine, but the situation of what we've had in the world, which we'll talk about a little bit with the pandemic that we're still living, is not over yet. And it's still quite uncertain of where we may be going. But we know this has been going on for a long time. And one of the themes, as Dr. Durbach mentioned, I spent a year as a senior fellow at Harvard Kennedy School, and my theme was getting past Sisyphus. And Sisyphus, we may recall, if you've seen this in the British Museum or otherwise, but he was this legendary king that was cast to push a stone up to a mountain, as it says, the crest of the hill. But once he got to the top, weight would turn it back, it would roll down, and he would have to do it again and again. And he was punished, basically, to do this for life, for immortality. and hence a story of what maybe we're up against still today. As we move along, so I like to move along, it's not advancing. I wanted to mention that there's been a lot to be done to attain the global goals for some time. And before we had these global goals, which you now call Sustainable Development Goals, we had this Millennium Development Goals. And I had the opportunity for the first time where there was a hearing at the US Congress and the Council Committee on Foreign Affairs to talk about the MDGs and what we could do through partnership. And I was invited in 2010 now, while I worked at Johnson & Johnson, to represent the private sector, because the private sector has an important role here. And we said that in the congressional hearing, myself, the lead of the UN Foundation, Kathy Calvin, and a couple of others of us testified, and we had hoped that the partnership piece would come through. And happily, if I can say that, or fortunately, we realized the power of partnerships, and the partnerships, in fact, did come through in the next round of the Sustainable Development Goals that we all know exists today with the SDGs. So we know we have the SDGs, and as I said, what came from the MDGs, if you remember, and frankly, the world did not successfully attain those. We made more goals rather than having the 5 or 6 that we had great movement with the MDGs, Millennium Development Goals. We had the SDGs, and number 17 is really what's most important. And what we're discussing is we can't achieve any of these if we don't have partnership. And we also moved not only from infectious disease, we have MDGs to SDGs, but it's a Sisyphean task, if I can say that. We're trying to push this up the hill. We have many that were not even had movement now that we're 5 years into it, and we have big challenges. And I've been involved, I wanted to share with this partnership. And in fact, you can see I'm sitting there on the far right, and there's Ban Ki-moon at a meeting in an ECOSOC chamber, that we had some very high level engagement of wanting us to succeed. We came up with guiding principles, and not only with Dr. Durbach's meeting, which she highlights in the invitation, but I pulled up a couple of other ones where we're going. 2017, public-private partnerships, member state initiatives to ensure success. And this was a meeting at the UN I participated in. And around the same time, here was something in 2019, the future is now. Those were the themes. But what happened? Well, we had these great ideas, a pie in the sky. We have these SDGs, these global goals. What can we do? And here we have the UN, World Information Transfer, the great work, the work that I've been working with the U.S. Council for International Business Foundation, and we launched Business Partners for Sustainable Development in 2019. We had the U.S., China, the Europeans working together. We were making good progress. But then what happened? Well, we had in December of 2019, the makings of a public health emergency of international concern in January, and the pandemic that was declared in 2020. And we knew what to do. So I'm engaged on the Board of Global Health with the National Academies of Medicine. And we met actually before it was even called a pandemic. And we said, we need an urgent call for a coordinated, trusted source to tell everybody what we need to do and also what we need to know. And we put out there, this is a test of the global health polity's credibility in addressing a legitimate public health threat with an unknown trajectory. We knew that this health was a common currency. This pathogen would cross over borders. And I wrote this with Larry Gostin of Georgetown Law Center, Naj Mishkati, who's also spoken in a World Information Transfer event I knew from both Harvard and the USC Engineering. And Ken Rabin and Ruth Parker, Ruth being an expert on health literacy and getting the public information that they need to know. And we tried to do this. What 5 means, it was a top 5 paper by the National Academy of Medicine that year. But just because we say it doesn't mean it translated into action. And that's one of the themes that I want to get forward here. How do we get to our global goals? How do we translate activities into action? How do we get all sectors involved? Well, we try to say, okay, well, people want to see evidence. Well, let's conduct some surveys. And I could spend, well, an entire course on surveys, but I'm just going to have one survey here that was just published 2 weeks ago now in Nature Medicine, actually January 8th. And we did 3 years of data in 23 countries that we were looking at. If there were a COVID vaccine, would you be willing to take it? That's what we asked the first year before there was a vaccine in 2020. Then we asked in 21, would you take it now that it was there? Then we asked in 23, after another year, would you take a vaccine? So these are 23 countries, 1,000 people in each country, all the representation that is the proper survey piece that also made it through a peer-reviewed process and published in Nature Medicine now on its third piece. And what we found with basically 59% of the world's population is that people are accepting of vaccines. Good news, right? We've eradicated polio nearly, although it's coming back because we don't have good vaccine coverage globally. We've basically have eradicated smallpox, with the exception of some places where we actually, are still having control piece. But vaccines have made strides that we never would have thought in our last century, and we need vaccines today. But the good news here, and this has been reported in the news now, is that we have increased acceptance. Once people saw that it's scientifically sound, that it was saving lives, people increased. In the United States, it increased to 80%. That doesn't mean that 80% of the people in the US have full vaccination. That's another issue on equity. But it increased in many, many places, with the exception of South Africa, which maybe has had some interest. But France, which was toward the bottom of people skeptical, moved up 38.7 points of people going from not wanting to get vaccinated to get vaccinated. So the bottom line that I take away from our surveys is that, yes, we can make a difference. People are movable. Now, we're not at the 90% that we might need, but we can work together to do some good things. And I think that's a theme, that it's not a Sisyphean task, that it's going to roll back and get worse. There are places that we can get better, but that doesn't mean we're doing that with everything. So there really is more to be done. And we know also in the midst of this pandemic that our current institutions, public and private, failed to protect the people from a devastating pandemic. Millions have died. Millions continue to get infected. And without change, we also know these institutions will not prevent a future one. And this is not just me saying this, and those of us who knew that we've done a poor job, but this was the Independent Panel for Pandemic Preparedness and Response. And many of us know Helen Clark from her work at the UN and also in New Zealand and so forth. But she led this, and she was quoted saying this in the New York Times, that we need to do better. We need to prevent a future pandemic. Now, another group got together of 368 experts led by Jeff Lazarus at IS Global. And I was one of the global experts, if we can say, but 368 people, and they issued a Delphi consensus with 3 iterations. What are ideas? What could we do to get over the pandemic? And you can read about this in Nature. It was published in November, and there's a lot of coverage on it still. If you just search for the multinational Delphi consensus. And these are some of the top line recommendations where you had over 95%, maybe even over 99% of agreement that these needed to be done. And what I've circled are the ones that cannot be done by government alone, and cannot be done by the medical sector alone, or science alone, or any group alone. The number one is we need a whole of society approach in the top left. When you go down to the bottom on number 9, we need a multi-stakeholder global effort. Under communication, we need to collaborate for messages. We need to partner with individuals. We need to work to engage communities. We need to better coordinate. We need to collaborate. We need to engage trusted leaders and organizations. All of these are areas of interest, and we have put this Business Partners for Sustainable Development with the USCIB Foundation together to help develop opportunities for partnership for these goals. But we believe if we don't get out of COVID, and we have to live with a pandemic that's uncertain and continues to threaten trade and travel, we're not going to get back to the world as we know it and as we would like it to be. So we are hosting business partner roundtables also to come up with really top-line action reports and expert advice of how to attain these goals, as there's more to be done. But all this information and evidence, I showed you facts of these surveys that get published of over half the world's population. I've showed you now a consensus meeting of 368 experts in 112 countries. But does it matter? Maybe not. There's, the facts don't matter show that we have every day in the news. I'm sorry, Jeannie, the host says, but your answer was correct, but Kevin shouted his incorrect answer over yours, so he gets the points. We have a loud cacophony of anti-fact, anti-knowledge, anti-science folks that are out there, and how do we get around that? There's more to be done. So we've been engaging with the business sector, and in the middle of the pandemic, we wrote about why businesses must help to build trust in the COVID vaccine. I did these with colleagues at Harvard, Rebecca Weintraub of Adjunct Labs, and we talked about what the biggest employers could support. Common sense information campaigns to promote vaccine acceptance and diffuse anti-vaccine sentiments. And in this article, I wrote, joining with the international business coalitions, such as the recently launched Convince initiative. Same thing, as we said before, the multi-sectoral, work with governments, NGOs, private sector to implement, develop, and evaluate global, country, and audience-specific campaigns to advance vaccine literacy. We said this, and we were able to do this, and I want to thank Dr. Durbach for inviting me in 2021 to talk about business partners to convince, how we can do this. And here we had a global workplace challenge. And I'm going to share that we've evolved the workplace challenge to even more activities that we think could help get us out of the pandemic as we know it, and can help us be protected from COVID in the future. A new campaign, Business Partners to Convince, is launched. There's more to be done, helping people in the workplace where this could be a small enterprise with 5 people to enterprises that have workplaces around the world with these multinational companies. Inform people of risks. We know when there's a wet floor, now we can remind them of the risk of COVID. We know what to, break the glass if there's a fire, help provide protection. And also, show people the way, if there's a fire or something to exit, where's the exit? A healthy workplace. All of this is simple, attainable, and vital for a safer workplace. But to do this, it requires leadership. Leadership matters. And there's more to be done. And here's the challenge again that I mentioned last year. I'm not going to go through this for the sake of time, but know that it exists, and you can get this on the Business Partners to Convince website. And also, if you're interested, there's learning modules now. We have 7 learning modules of how to engage with the challenge, identify vaccine ambassadors, people that can talk about it, how you can build trust, and counter misinformation, which is one of the biggest challenges. And these learning modules are there. But getting out of COVID is only one part. And just the last couple of slides, just to mention, there's more to be done, and we have to deal with COVID effectively. First, we know there's fatigue. It won't go away on its own. I wish I could say full stop that COVID will go away. It will not go away. This is not an old abracadabra approach. A business has priorities, but we still have impact from COVID. And complexity with the variants. Now we have this XBB, what's going to be next? And the vaccinations are not only waning because people haven't had boosters, but also waning in that they're not always keeping up with all the variants. So there's a lot to be done. Misinformation, the politicization is horrible. I could hold up Wall Street journals on Monday and New York Times on Monday this week. 3 articles in the op-ed pages of vaccine misinformation and the challenges, everything from Grant Wall with an unfortunate death at the World Cup, a very well-known sports journalist, a cardiac arrest on a football field in the United States being blamed on vaccines. None of this is factual. None of this is real, but it's that facts don't matter getting out there. And there's a constant battle against this. And frankly, it's not only the small vocal minority to blame, but the government is also sometimes causing confusion. We still don't have that coordinated, trusted source. And the mistrust is really a challenge. And that's really the piece to talk about here today and the questions that I know we'll have. How do we build trust in institutions? How can our NGOs, such as World Information Transfer, have a strong ethical voice in addressing government and media? How can we let and help the businesses that want to be part of the solution engage? How can we build vaccine trust and safety and effectiveness? And all in all, I think we have a cacophony in public health communication. And I wrote about that for the Council of Formulations. And there's the place below if you want to read it. You could search my name and find it. But I give a lot of common sense ideas that we need better from our health policy. We need better from our government. And I think we can do it. There's more to be done to achieve the global goals. Here's the Sisyphean task that Titian painted centuries ago. But we have a lot of challenges on the left of the screen with the disinformation. The challenges come from the left and from the right on getting us out of the pandemic. We have trust that's crumbling. We need to build it back in our institutions that we have, whether they're UN related, whether they're business related. We know that business continues to come out significantly higher in many countries and the media and politicians. How do we build that strength in the private sector? And I'm going to end with my final thought. And thank again, Dr. Durbach and World Information Transfer and the board for the work that's been done. Where our virtual voices, and our voices need to be out there. But to remind, when Camus wrote about Sisyphus centuries later, he wrote, "There's no longer a single idea explaining everything, but an infinite number of essences giving a meaning to an infinite number of objects. The world comes to a stop, but also lights up." Camus also wrote about the plague, and we think about the plague in the last century, well, centuries ago, and then what happened afterward, the Renaissance. Unfortunately, we still have this pandemic that's there, and we don't have a single idea of a way out. And I'm not saying that we have the single idea here today, but there's more to be done, and there's only more to be done for those of us to work together. So I'm hoping with both the work I'm able to do with my role as business partners to convince and work with the USCIB Foundation. Thank Christine and others for being on the board of World Information Transfer. My academic works with CUNY School of Public Health, Columbia, St. Andrews, and Tufts Medical School. I'm happy to do that. But also, working with vaccine equity cooperatives, health equity cooperative groups, and others. We need to figure out ways to get the partnerships together. Health, SDG number 3 is only one of them, but health is the common currency that we all share. And hopefully we can work together, notwithstanding the health and environment linkage this year, not only what we had with COP26, but 27 will be there. We all have to continue to help focus and engage and have meaningful impact working together. So with that, I'm going to stop. I believe, Christine, it's over to you look forward to the dialogue here.
Thank you very, very much for a very, very clear, lucid explanation. I think that you are absolutely right. There just is not enough trust in our politics, in our public presentations, and people are just resisting because there's also a lot of evidence that many people that have had the virus, that have had the injections, are not well, and many of them are still dying, and many of them are in the hospitals. So there's such a conflict and misinformation about the efficacy that I can understand why it will take a long time. Hopefully it's not going to take as long time as in Renaissance with the Black Plague. But anyway, let's move on to the questions that we have received. So over to you, Susie.
Thank you, Dr. Durbach, and thank you, Scott Ratzan, for this wonderful and insightful presentation. We received some questions from our audience members. The first one is, what examples do you have of really successful private and public partnerships? These, as you mentioned, have the potential to really drive results when you have engagement from both sides, but sometimes there are challenges with actually implementing them. So was hoping, could you talk through some successful ones, then on the other side, maybe some challenges with executing these?
Sure. I mean, just to stay on the theme, Susie, on COVID is, I think the vaccine initiative, the Center for Epidemic Preparedness Innovation, a couple of those that have been funded through both governments as well as private sector and foundation, have certainly made huge differences in childhood vaccination around the world. We have had success with those groups, although because of COVID, I think you have 40 million children that are under vaccinated right now, and more that are in trouble from catching COVID. This is also a pediatric issue, and children are at risk. I think the many places we've also had public-private partnerships that have been initiated by corporations, multinational ones, some of which have been very successful in climate change, and at least trying to initially deal with getting us on the right track with water and others. But the big health ones, I think, are the ones that are easiest to point to, at least at this point, but are definitely at risk. Just because we have the Gavi, the Global Vaccine Group, doesn't mean that they're able to get the vaccines in country and in people's eventually arms, which is where the vaccines are now. Many of those have expired that were allocated. Many of those that have been paid for, oftentimes by tax dollars. And frankly, a lot of these things happen because they're often run too much with governmental groups in mind, and don't always, engage all the sectors throughout where they have joint ownership. So I think we can do better, but I think those would be the examples now that have made a difference. I think in the humanitarian front, clearly disaster relief, there are partnerships there, but I tend not to use that as an example, because that's what we all should get together on disaster relief when that happens. We need to band together. The proactive ones of getting children vaccinated, of giving people information. So for women's health and reproductive rights, we're starting to make, I think, some more progress, frankly, again, in that space, because we have to, unfortunately, because of the threats to women and in education and reproductive health and others. So that, I think, is hopefully an answer that makes a difference. And there are many other people that think we can use examples not only of partnerships but of brands, such as a global hand washing campaign, which frankly began with Unilever and Dove, and Miriam Sidibe, when she worked there, put together the Global Hand Washing Day. That people might think that's a small piece, but just by lowering infectious disease spread through hand washing has saved a lot of lives and proper hygiene. And frankly, it sold a lot of soap too. So, it's a win-win, but we have to start to look at those kind of things in society and think about brands and products and ways that we can leave the ego at the door to make a difference for a better world.
That makes a lot of sense. Thank you. And thanks for sharing the learning modules and references. How do you advise audience members to navigate and make the most of these resources, and what do you want and hope that they gain from it?
Well, thanks, Susie. And I think that logo, that's one of the participants, is Jen Faucon at the USCIB Foundation and Business Partners to Convince, who's done a phenomenal job of putting these learning modules together, that while they've been supported mostly by large multinational corporations, and I jumped over, which are members of the U.S. Council for International Business, it also includes SHRM, the Society for Human Resource Management. It includes a lot of the other industry-supported events, groups such as the International Federation for Pharmaceutical Manufacturers Association, Vaccines Europe, and others that have given some of the background and scientific data, with the idea that we need to give people vaccine literacy, that they could understand when to use a vaccine, when it works, even the flu vaccine this year, right? Hopefully we've all on the phone or on the Zoom here have got that. And we've got other vaccines if we're over a certain age. Do we get a shingles vaccine? If we're under a certain age, do we protect against cancer with HPV vaccine? So there are vaccines in general, which is what the learning modules are about. Ways to do that for COVID when it's a threat now, and flu and other pieces. But they're meant for anybody, can even be a small enterprise. And you can choose these, there are 7 of them, But if you're just interested in creating a vaccine ambassador or someone at your community or someone at your company, you can go to that module and go through it. And then it can reference others. So they're freestanding, they go together, and it's not just me speaking. I do the intro to each of them, I should say, but we have other experts from different parts of the world. We have a great Canadian group, Dr. Ji-Shop Hu of 19 to 0, does a lot on misinformation and work that they've been doing in Canada. We have, people from around the world, Heidi Larson, who is an anthropologist, who's the expert on the Vaccine Confidence Project, talking about how to build confidence and listen to employees, listen to people in your community. So all of those hopefully are important that we could, we can engage.
Thank you. That's very helpful, and look forward to checking out the resources. So you allude to a bit to this topic about how well society is actually informed about COVID-19. And do you think information about prevention and risks are correctly represented? How do you think we can kind of improve literacy?
Well, thank you for that challenge. And I call it a challenge because I've been speaking about this a lot. So when we're bringing it with virtual voices, and I spoke about it at the beginning. Heidi Larson and I had written about the challenges of vaccine confidence in 2011 in the Lancet. In 2019, we wrote about the challenges of the United States, that we needed better federal action because we saw the issue, and then COVID hit. So the misinformation is getting worse. I'm trying to put together a presentation for the big meeting in Seattle next month called CROI, which is on opportunistic infections, that if we can't get around the misinformation for COVID vaccines, we're going to lose faith in science that could be for certain medicines and so forth. So the answer is we need literacy at all levels. Today's New York Times happened to demonstrate where Finland leads the Europe in both education on media literacy, and a country of 5.5 million people, which has great education, has the strongest understanding on misinformation and has been able to keep it away, shield it off by investing in media literacy training for youth for years. I think there's more opportunity to do that in this country. Through one of the groups I work with, with Convince, that we put together this coalition for new vaccine information, communication, and engagement. We helped develop Big Shots, and Big Shots is a campaign to identify people in local communities that have made a difference in combating misinformation or getting people vaccinated. And with the American College Health Association, I see a lot of young people on here. We put together a toolkit of how to use social media and how to leverage Big Shots, with the idea that young people are the most important asset in this campaign for not only misinformation, but vaccine literacy and understanding. And we think this Big Shots model of social media and youth activism is something that can make a difference, not only for COVID, but can translate into other areas. And hopefully, if those of you are interested, please shoot an email. In fact, maybe we can have a future virtual voice with Big Shots to talk about it. While it's mostly been in the U.S., I know that there is, we have the Health Communication for Social Change program. I co-direct at CUNY School of Public Health. We have people from around the world, including Azerbaijan and others, that are interested in taking our model that we have on health communication for social change and applying that. So happy to share that as well. And I see in the chat there are references that Jen Fokine has put out, and you can certainly, through your work here, Susie, and Dr. Durbach, through World Information Transfer, or my other links that are public, get in touch with me as well to help on this.
Thank you. And one more positive outcome of the pandemic has been kind of collaborating virtually with people from all over the world, and that can sometimes level the playing field so that we are, collecting ideas and exchanging information with everyone, regardless of where they are, and kind of increasing equality. outside of these virtual gatherings, are there other ways you think we can sort of level the playing field so that there's unity established to achieve the Sustainable Development Goals and make a difference altogether, bringing different stakeholder?
Well, thank you for that question. And I know William Remek, who asked it, leads one of the efforts of Giant in dealing with immunization activities globally. And I commend those different efforts. We believe there's a big challenge for this, right? There's disparate groups. I can name about 6 of them. I'm involved with the Pandemic Action Network, Alliance for Disease Prevention, a variety of other ones that are out there. And I think it's right to say that, frankly, a lot of these are webinars, just as maybe this one is. And how can we establish a stronger link? And, thanks for asking. We believe with my work I do with the USCIB Foundation, we can make a difference. And our theme, There's More Can Be Done, that first starts with these learning modules and campaign, is going to bridge a bigger gap in 2023 with business partners roundtables, which we're launching this year. Next month, we're going to have looking at the nature consensus that we on the pandemic and how to address it. We're bringing together, and each of these we hope to bring experts in a way to try to have different sectors that can then put ideas together and can put action points out. We're going to call it a top-line action report that is not just, okay, here's another report, but here's a report for some action. So while it's great that we have 57 recommendations from this global consensus group, we're now not going to, 1, remember the 57, and 2, we're not going to be able to do all 57. So how can we prioritize? And our business partner roundtables will be looking to help attain the global goals. I think the question that William's raising is a big challenge that we need our governmental, non-governmental organizations and other strong civil society actors to give us that opportunity. We have done that with USCIB Foundation. We bring in the experts that I mentioned. We partner with Georgetown Law, with Larry Gostin, who has a WHO Collaborating Center on Global and National Health Law. We collaborate with SHRM, the Society for Human Resource Management. We collaborate with some of our leading companies that have people in the field or on the ground. And these are companies that people might say, well, we don't want to work with them, but we need to work with everyone. Everyone should be included, whether they're energy companies or tech companies. We all are part of the solution. So we're trying to create that. You've heard the term Chatham House rules that oftentimes leave the ego at the door, solve the problem, bring your expertise in, and we'll publish something on the way out that will make a difference. And then take that document or take that information or make it in the social media in a way that it can inform others. So that's our hope. But we also need leaders to buy into it and not say, if you go to the World Health Assembly and you're wearing an NGO badge, well, you're not allowed in this meeting because it's, member state only, or you're not allowed in this meeting because it's closed and it's only for XYZ folks. We need to figure out the right way of opening up these meetings that are where you need a badge, which is fine, you need a badge, but we need to have appropriate space. And then 2, also on the flip side, active cooperation and participation in meetings that we instigate, whether it's the World Information Transfer annual meeting, when we get back, Christine, when you do them again inside the UN headquarters, they're fabulous. And the delicate dining room meetings that you have afterwards for dialogue to talk about issues that you might not even been able to get to in a plenary. We need to be able to have people participate in our business partner roundtables. And, we need government and others to open up and give the right level playing field, which is, I think, the right question. So we are able to come up with solutions. Because frankly, I think the Helen Clark quote on, our institutions failed us. These Bretton Woods institutions, as great as they seem, and the buildings that they put in place, and the financing and the funding that they have, these are 75 years old. And, companies that were around 75 years ago are not around if they didn't evolve. Talk about the Polaroids, the Kodaks. I mean, we can go through a whole variety of them. And these aren't just mergers. These are companies that just are obsolete. we have to evolve our institutions similarly and use some know-how to do that. And that's why I personally, even though I'm in a school of public health, I'm a public health professor, if you want, with the hat one day, but the hat as a public health professor includes working with the business community, and we have to get over that. There's places where we talk about commercial determinants as if they're all bad. Commercial determinants, yes, they have sold us tobacco. Yes, they do ultra processed foods, but commercial determinants also create jobs. They lift people out of poverty. They build energy efficient manufacturing. They're moving towards what are called electric vehicles. I mean, there are things that we can do. So we have to look at commercial determinants and think about the scientific term, two-tailed, not just the bad side, but the good side. And we obviously want the good side to be bigger than the bad, better than the bad side. And realize sometimes we have to have the bad side, to get to progress. And I think that we're all in this together. And I'm come from the health side because health is the common currency. It's not the dollar or the euro or any of the other or any currency. The currency is really our health. So if we can build that well, we'll have better life expectancy, we'll have better quality of life, we'll have a better world. But we need to do it together and bring people together. And also, as another slogan that we have with business partners to convince is that leadership matters, and it matters who's at the table, and it matters who's taking what they learn at the table and integrated into their operation, whether it's business, big government, municipalities, all the way down to our 1 or 2 person activities that we might have with our friends, with our community, with our schools, with our places of worship, wherever they may be.
Thank you. That was very inspiring, and agree. It takes all walks of life, regardless of where you work, to get there. So what percentage of the population should be vaccinated to achieve global or national immunity?
Well, thank you for asking and even calling it global and national immunity. We try to also steer away from this idea of herd immunity, because herd immunity, first of all, it doesn't sound good. It was 1927, it was more on animals, and then you needed to, for the herd to be immune, 90+% of the population. We started to call it community protection, and I say we. It was also Walt Ornstein, who's ran the National Vaccine Office at CDC, who wrote about that in the national academies. And the reason why it's community protection is we know that you need a certain amount of fire departments or fire brigades, depending where you are in the world, to protect you if there were a fire or a disaster, and you put in fire hydrants. You need a certain number of traffic lights or engineering with roundabouts or rotaries or intersections or whatever they might be for traffic safety. So we need that for community protection. People have said for COVID, we thought we need 90%. We know measles we need is very, very contagious and need over 95%. But frankly, I think if we're at a level with boosters over 80%, we'd be in a much better place. We're not near that. In the United States, it would take years to get every child vaccinated at the rate we're going now, which is horrible. In other countries, we have vaccines that are, if I can say, haven't been proven to be as efficacious. The mRNA vaccines have been proven thus far to be the most efficacious to protect people from COVID. The other vaccines, if I call them the attenuated viral ones or others, have not been as effective. And some of them, we don't really even have the numbers to know how the Chinese vaccines or others that have not only been in China, where the numbers might not be clear, but were exported in Latin America and other countries. So the question, while it's important to get 90% of the world vaccinated, we want to get 90% of the world vaccinated with the best quality vaccines that work. And we're not really all talking about it. And even if I can say the limitation of our survey is, we say, would you get vaccinated? And, the vaccine in India, and there's some great new vaccines there that have been made. Peter Hotez, who's nominated for a Nobel Prize, has come up with a vaccine that's been free with the intellectual property. I believe 80 million children already in India have taken it. There's great strides that can be made, but we need good vaccines. We need good distribution. We need access. We need vaccine literacy. And, we need good understanding of policymakers to try to strive for that number of global and national immunity that you're, whoever asked that very good question.
Thank you. What can ordinary citizens do to achieve the global goals in your perspective? Like, can you advise what everyone can do together on a daily basis?
Sure. Well, the first thing is what we do and live to address the environmental change. That is the threat of this century, of this generation, our future generation, for my kids and hopeful grandkids someday, that we have to address climate change, full stop. So anything that we can do individually to think about the environment and know what we're doing is, from all sides, not just, water, air, waste, consumption, you name it. And the second thing would be, while we're calling these global goals or SDGs, very small percent of the population knows what those are. And even a lot of companies, while they might have sustainability officers and so forth, we found that companies don't all know what they are. So we need strong awareness that the UN is not only, I wish it would be a stronger Security Council and approach to address issues such as Ukraine, which frankly, I know it's been the hearts and minds of Dr. Durbach's and WIT's work. They frankly haven't been that effective, right, there. So if the UN is going to be more on the social side with ECOSOC and other pieces, how can they do that better? So individually, I think we can all do our own individual effort of what we do with our lives. All those of us who are listening now and are engaging, how do they advocate more to organize others in their communities, at your schools, with your business networks, with where you work, where you worship, governments, whether it's a local, national, global level, how can you engage that? So it has to come from the bottom up. It can't just come from this big building and headquarters in New York, nor the UN groups that are regionalized, whether it's Geneva or the other institutional places on the ground. So that would be my piece to everybody here. The fact that we're all on this call, we know what they are. How do we get an exponential growth, which is necessary? How can we do this with social media? How can we do this with the ideas which many of you embody? How can we use both clever TikTok, but also long form, if they're movies, if they're articles? We need to keep a strong advocacy and front of mind on these global goals are achievable. They might not be all achievable by 2030, but we have to have the trajectory in the right direction, or we're all will be doomed. So that's my answer, Susie, to you and the group.
Thank you. So next question is related to a recent WHO communication about the most recent variant of Omicron. They're seeing that most sequences are from the US, around 82%, and about 8% from the UK, 2% from Denmark. Are you aware, and any comments on this? Like, why do you think we're we've had the most cases, and what we should do from here?
Well, thanks for bringing this on Virtual Voices. Unfortunately, I happened to listen to the WHO media briefing yesterday to hear, they actually called this the most contagious before even the CDC did. We're going to have variants in all parts of the world. There's probably a whole bunch of them in China that we don't know about, and surveillance and reporting is really important. And frankly, we don't have the visibility or the transparency that we need from China and other countries. The US is doing a better job at surveillance, but it's not perfect. And frankly, far from perfect. So we do have the information that this is mostly in the Northeast, and these variants will come from just the fact that we have circulating virus, that we don't have everybody vaccinated, where we're able to tamp down transmission, and viruses mutate. We've seen this, and they will evade. We have been unable since 1987, when we first identified the HTLV3 is what it was first called, then later HIV, the human immunodeficiency virus that we know of that causes AIDS. We have been unable to get a vaccine to address HIV because it also had mutations and is very difficult. So we're going to continue to have these mutations. This one, fortunately, doesn't seem to cause excess hospitalization, but people are hospitalized at a similar rate. And unfortunately, the 0 to 4-year-olds who don't have vaccines continue to be the higher amongst children. So we have to pay attention to it. We have to do more for our kids. I do think you will probably see more of it in Europe as travel continues. And after the XBB 1.5, there'll probably be another one. I'm almost for sure there will be. Hopefully it won't turn more deadly, but it also, could certainly be more transmissible.
Thank you. Very helpful color there. So you spoke about in your presentation some of the mistakes that and challenges we dealt with during the global healthcare campaign with this pandemic. How do you think we can avoid some of the mistakes in a future pandemic?
Sure. Well, I jumped over and I said there was an information vacuum, and the WHO called this infodemic. There's others that actually use the word infodemiology in the past, where information can help cause disease and has. So I think, behind me, I edited the Journal of Health Communication. I've been editing that for 27 years. In my view, and many authors have written the same, is that we need better communication to fill the gap, and we need leadership in communication to fill the gap. So it could be whether they're packages of information. So the media and others, journalists who are covering things, have the best information. That doesn't just mean I went to the WHO website or listened to a briefing or looked at the CDC piece, but actually where it's understandable for people. Some cultures, they want to see more, some they want to hear more, some they want to hear from multiple sources, but ways of filling that information communication gap. The coordinated trusted source that we wrote about for the national academies, where is it? Why don't we have that in Washington? Why don't we have a strong Surgeon General if we would have that for the United States? Or why don't we have a stronger spokesperson or a spokesperson that would be the leader that we would go to, whether it's from an academic or scientific society, or from a quasi-governmental organization or a member state organization. The National Foundation for Infectious Disease has some great people here in the United States that do global work too. There's other groups that have been out there, but unfortunately, it's there are too many. So I think we need a coordinated, trusted source that would be there to build trust. And once we have that trust, that will help build upon it, and then figure out ways of perhaps creating the proper channels that not only people that want health information, but proper channels of all of us who want to help attain the global goals have information that we could track, everything from environment, climate change, infrastructure, industrialization, all the 17 that are out there, and work appropriately. And I don't think, it's certainly not going to come, if I can be fair, just from the UN alone. But it's certainly also not just going to come from one member state alone. I think it's something that we need an appropriate investment. And even when the Surgeon General wrote in the United States his first report on confronting misinformation, he said we need, quote, investments at scale, close quote. And I say that very specifically because we don't have an investment at scale. We have a spattering of investments. We have a confetti approach. And we know that confetti works for the moment, it comes down and it's done. We need targeted approach. We need an approach that is sticky and has a cadre with an army of people that are armed with the right information to help people make appropriate decisions. And that's why we call it health literacy. That's why we work for not only health equity, but equity. And then having equity where people are armed with the knowledge and skills and wisdom, they'll make the appropriate decisions. And, obviously this is a theoretical piece for people who want to put the academic hat on, what we want to call it, epistemology or so forth. But I think it's more of how do we really live, act, and do. And, that's why, business partners to convince is engaged in that space. That's why World Information Transfer is engaged in the space. That's why many, academic institutions are engaged, and why we also I invite any of you to submit articles or engage with our Journal of Health Communication, which also has a community of thousands of people who've written in articles as well.
Thank you. And I think you've responded to this question directly through your other responses and presentation, but any additional points you'd like to make on how corporations and journalists can really influence people's confidence in vaccine efficacy?
Sure. I mean, I think we have to work together. Every time we do a poll on trustworthiness, business is high, but frankly, the highest people are continuing to be health professionals. People trust their health professional, not the health professional with a white coat coming out of a governmental agency. They trust their health professional. And we have to figure out how to partner with corporations, journalists, and the health professionals that matter and that people will listen to. And many corporations have health professionals that work in there. Some are sustainability officers, some will, partner with the community. So I think that's how we have to think about it. The theme, just like number 17, partnership for the goals, is partnering together, and journalists also realizing it's not always one side is this and one side is this. There's one right side in terms of democracy, democratization of ideas, science in terms of vaccines and addressing the pandemic. It's not one person who's this anti-person who's throwing whatever out there at the establishment that is equal to the others. So it's not journalists as you put both sides, because there's a preponderance of evidence on one side and a small amount on others. And we have to really begin to think about that more in terms of even how journalists approach issues. We don't have to present controversy, which unfortunately is why we have terms like vaccine hesitancy. That's a lot. It's been created more by the hesitant in the community and the reluctant and the anti-vax. And, we need to figure out ways of covering all of this properly and working together to achieve the global goals. There is more to be done.
Yeah, that makes sense. And that kind of relates to another question from the audience is media portraying the problem of COVID correctly, in your view?
Well, that's a huge question. We could have a whole talk in who are the media. Going back to James Fenimore Cooper in 1831, they say is the monarch of the country. It doesn't matter who says it, as long as people believe that they say it. Well, they these days is the media. It used to be media would be the one person you watch on TV. They gather the information, or they put it together in a 30-minute cast. It'd be on the news, radio, and so forth. Now we have the social media where everybody's an expert quickly, instantaneously. And that's the problem, that who do we trust? And that's why the trust is the theme. Our institutions that have high ethical standards and people that are in those institutions, we need to trust more. And that's somewhat what I hope that we can do, and build the right social media and not the media being one monolith.
Another two-part question, which is, do you think there are other ways to avoid infection outside of vaccination? And the second part is, can society protect themselves during a war, like how we were dealing with conflict during a global pandemic?
Well, I mean, yes, I skipped over. Look, I just mentioned vaccination because that's an important piece. Yes, wearing a mask. Yes, proper ventilation. Yes, social distancing and not having crowded events. All the things that we've heard along the way are certainly there, and they're good health and hygiene, hand washing, and so forth. So yes, we need to think more of that, and that consensus piece in Nature that Jeff Lazarus and others put together. Please look at that if you want to have a variety of those other ideas. On the second piece, I'm going to pass it back, as I see Dr. Durbach on conflict. I've written and engaged with Health as a Bridge to Peace. We have stopped wars and conflict zones to get kids vaccinated for polio in Africa and other places. There are places that this comes together, but we need to do better. And it's unfortunate that we have such armed conflict still in 2023, but it's a world that we live in. So I know I've been watching the time with you, Susie, and I see Dr. Durbach, I think, inching to say something, but I'm happy to continue on as you like.
No, actually, I think that what you're doing is an excellent job. Basically, I read the question that just came to me, why did you start the Coalition for Vaccine Information, and how satisfied you are with the progress that it is making?
Well, thank you. And we launched it actually at the high level political forum before there was even a vaccine. because work with Heidi Larson, who wrote the book behind me, Stuck, on how vaccine rumors and unfortunate lies have stuck with people, and it's hard to wrestle them away. And we know that already was causing deaths and unfortunate issues with vaccine preventable diseases in different parts of the world. So we knew this would happen with COVID. And Heidi reminded in a public event with Bill Gates, no, these rumors won't go away. And we had a lot of experts, so-called experts, saying, oh, don't worry, once we have a vaccine, the whole world will take it. And we knew, at least Heidi even more so from her global listening project and others, that people wouldn't. And we did the surveys that showed, yeah, there was about 30%, sometimes even more, that would not take it. So we started it with the idea that we could bring a lot of different parties together. And we did that. And we had a lot of meetings and regional meetings and virtual stuff, which was difficult. But the business partners to convince became the most powerful group because, one, frankly, business was a little bit more organized. Frankly, we had some good support and some good leadership with the USCIB Foundation, with Abby Shapiro putting some energy behind it. We had, funding enough to get a business network together with the International Organization of Employers, with the business at the OECD, with the International Chamber of Commerce and others to want to get their members involved in a network. So we plugged in. So the answer is, yes, I'm happy that we did it. 2, yes, we could have done more. We didn't accept any, there's no public sector or governmental funding for it. And 3, I'm very satisfied at this point of what we've been able to do with business partners to convince. And that's why I mentioned we're moving to these business partner roundtables, and there's more to be done because we know that we can do more with our network and keep building on business partners to convince and have business partners for sustainable development engage more as well.
Let me ask you, did you consider placing a point person like a media star to represent the importance of COVID vaccination? Very often, at the UN, they present a man or a woman that basically can connect to a public much better than a business individual.
Yeah, I wish we could. Look, unfortunately, we had the flip side. We had Djokovic, the tennis champion, who was anti-vaccine, wouldn't go, was barred from going to Australia. We've had other visible players on different big sports that are doing it. And a lot have been silent, as well as music. A lot of people have been silent, or they were drowned out by the social media. I think it would be great to have that. I think we need that kind of coalition. And, Christine, you're right to think about that. How do we get those sort of ambassadors in such a way?
Well, especially if you're dealing with, if you want to focus on young people. Young people will not respond to a business individual, but they definitely will respond to somebody that they can identify with.
Absolutely. We have tried, and I think we even have a group looking at some of the TikTok videos that have had 1 million plus of people that just tell it like it is. They don't have to be stars. People want to see people like themselves. But I think we do both. I think we have to do both. I think we have to have this whole network approach that comes from the ground up. So, if your group and the network and you think there's ways to do it, we're happy to figure out ways to engage. And I know, Heidi, we have this broader convince, and then we have a whole business group that's organized. We're happy to do both of those. And I skipped over Convince USA networks. For those of you in the US, we have this vaccine equity cooperative. We've done a vaccine literacy campaign in New York. We've done a variety of different pieces to try to help bubble up. But it's the big shots piece is probably one that the young people could take advantage of the most. And like I said, there's a toolkit and there's ways to be part of that movement. Just like we call it a business movement, we can also have a movement for young people in terms of getting big shots going around the world.
Well, the young people, as you know, can influence their parents much more than the news media. So, Scott, I want to thank you very, very much. That was an excellent presentation, and it certainly gave a lot of food for thought. And so I'm very grateful that you were able to come again. And of course, hopefully you'll be able to come back when there is a more positive end to the story. And in the meantime, Susie, I want you to thank you for your excellent hosting as usual. So have a very, very good week and take good care of yourself. Bye-bye.
Thanks, everyone. Stay well.